I would make empathy a lot more readily available so that people embraced empathy as a tool for communication. At Friendship Bench, we say empathy is the ability to make people feel respected and understood. That's the one thing I would want to see. I would want to see people using less digital devices and leaning into human face-to-face interaction, just sitting on a bench and talking to someone.
Right.
Thirdly, I would like to see a lot more intergenerational connectedness. There's so much we can learn from our elders. I've learned so much from the grandmothers over the last 10 years plus. It's so powerful. I'm blessed.
Hi, my name is Juliet, and I'm the creator and host of Connecting the Dots podcast. I love ideas and problem solving, and my career in communication has led me down a path of curiosity. Why we do what we do, how we tell better stories, and how African scientists solve everyday problems. Join me on this enlightening and entertaining exploration of African science like you've never experienced before. Get ready to laugh, learn, and be inspired. This episode contains discussions and mentions of suicide. We understand that this topic can be triggering and distressing for some listeners. If you or someone you know is struggling, we encourage you to reach out to a mental health care provider closest to you. Welcome to this episode of Connecting the Dots podcast. We are joined today by Professor Dixon Chibanda, who is a Zimbabwean psychiatrist with training in public health. He's also the director of the African Mental Health Research Initiative, AMARI, a capacity building program aimed at developing excellence in leadership, training, and science in Africa. His research focuses on community mental health with an emphasis on developing interventions that are delivered by non-professionals aimed at narrowing the treatment gap for mental, neurological, and substance use disorders. His current research is around the Friendship Bench, a stepped care psychological intervention based on principles of cognitive behavioral therapy, which he will quickly expound on what that means, and is delivered by trained community grandmothers in Zimbabwe, and believe that the work has been expanded further afield across the continent and worldwide. Welcome. Karibu sana, Professor Dixon Chibanda.
Thank you very much. Thank you for having me. I'm really honored to be a guest on your program.
Dixon, just a quick overview on your background. Can you walk us through your childhood in Zimbabwe? We have, through our research ahead of this podcast, heard that you've mentioned before that, during childhood, there were tensions at the family setting that affected your mental health, even though you didn't really have a language for it. How did you manage those challenges? Was there a grandmother to talk to at the time?
Thank you. Yes. So I've always been surrounded by strong women from early childhood, and my grandmothers, both paternal and maternal, were really instrumental in my childhood, particularly dealing with the separation between my parents. And so when I look back, I think I struggled as a child, but I also don't believe in attributing the past traumatic events to our current failures. I'm a strong believer in getting on with what needs to be done with what you have at that particular time, and not looking at things that could have been that did not happen as a result of your traumatic childhood, and to try to use that to justify not doing certain things. While my childhood was indeed affected by the separation and subsequent divorce of my parents, I think it also created an opportunity for resilience.
And Dixon, is this what informed you transitioning into psychiatry as a field of study, your degree, and later on maybe your PhD and postdoc?
No, I think it was primarily events that happened much later on. When I was at medical school, I lost a close friend to suicide, someone who was always there for all of us. He was very bubbly. No one expected him to take his own life, and he jumped from the 10th floor of the building. So that was my first real major awakening. And I guess prior to that, as a child, I witnessed members of the family who were affected by mental health issues. But I think my real awakening was the suicide of this close friend. Because, when I got to medical school, I actually wanted to specialize in dermatology. I wanted to be a dermatologist or a pediatrician.
Yeah.
That's what I was thinking of. either dermatology, pediatrician, and then, third on the list was becoming, a physician. But somehow, I think because of that tragic event, I started thinking more about mental health. And when I came to Zimbabwe, when I was doing my housemanship or internship, I got deeper into mental health, influenced by people who were in the mental health space at the time in Zimbabwe.
And, the data is astounding because recently we have noted an upsurge of the number of suicide cases, especially for men. What are you seeing as a psychiatrist? And can you speak a little bit to just mental health, especially between the two genders, women and men? And given that on the 10th of October, just this month alone, we celebrated World Mental Health, what does that also mean in terms of creating awareness for this particular issue?
I think the world has increasingly become disconnected a lot more now as a result of digital technology, social media. It's ironic that social media connects us in a certain way, but it
Right.
also disconnects us because the connections that we have through social media are not always meaningful. They are not always based on strong values and genuine human connection. And I think that's part of the problem that we're seeing today. We've lost that community-driven connection, which is extremely grassroots. And I think that's where I guess the work of Friendship Bench comes in, and the grandmothers and the role that they play. So thinking about World Mental Health Day, just to go back to your question, there's a lot of awareness. Definitely the awareness has grown exponentially since Amari first started. And I think it may have partly been fueled by the COVID epidemic or pandemic that affected the whole world, because that did result in significant issues around loneliness, around anxiety and depression, which brought greater awareness. And so it was a blessing in disguise, I guess, for the mental health space. I think that's one of the reasons why we've seen the upsurge in awareness. But having said that, we still need to do more.
And are you seeing differences just before we go into the Friendship Bench? Because I'd like you to unpack a little bit about what the Friendship Bench is. With mental health, are you seeing any differences between the genders for men and women?
Yes, there always has been a difference. Women are more likely to get help when they are struggling with mental health issues than men. And I think this is also partly why, when you look at the statistics from Friendship Bench, last year over 200,000 people received therapy in Zimbabwe alone. I'm focusing just on Zimbabwe here. And almost 80 to 90% of those people seeking help were women. So we need to do a lot more to reach out to men who are struggling. And at Friendship Bench, we try to offer alternative ways of accessing services through the digital platform. We also have male therapists or counselors on the bench, but we still haven't seen an exponential rise in the number of men who are seeking services. It's mainly women. Yeah.
And Dixon, just going back to the Friendship Bench, can you just walk us through how does it work, and why is the focus on using grandmothers as practitioners?
The Friendship Bench is a brief psychological therapy, which is based on principles of cognitive behavioral therapy, by which I mean a focus on feelings, thoughts, and how they influence behavior. We emphasize a lot on the problem-solving aspect of it all, with components of what we call activity scheduling and behavior activation. The behavior activation coming through the support groups that we have at Friendship Bench. So the model primarily consists of training trainers who then go on to train grandmothers or the equivalent in the communities where they are working. And the training can take anything between 3 weeks to a month, depending on where we are training and who is being trained, because often it depends on the core competencies of the people being trained. After the training, the grandmothers are allocated a wooden park bench in their communities, and we facilitate referrals to those wooden park benches. We use social media. We use the primary healthcare facilities. So we sensitize. It's one of our buckets, sensitization and mobilization of communities so that people are aware of the service. And once that happens, people get to see a grandmother either by appointment or they just walk up to the bench when there's a grandmother. They can receive anything up to 6 sessions before they are then referred to join a support group in their community. Sometimes people will come for just 1 session on the bench and opt to go immediately to a support group where they continue to get support, particularly around issues that they are facing at community level. So in a nutshell, that is the model. That hasn't changed for more than 10 years. We're still doing the same thing. But of course, we are streamlining the different aspects of the model.
It's impressive because this model, you started it in Zimbabwe, and we have seen media clippings and a lot of visibility on your work across the world. I know we saw Prince William at some point talking about the friendship bench. We also know that you had some friendship benches installed in New York. Can you talk about how easy or difficult it has been rolling out this simple intervention, but a necessary intervention needed globally? How easy or difficult has it been introducing it worldwide and on the continent as well?
That's a great question. I think context has always been the main determining feature of how it's implemented in different parts of the world. So at Friendship Bench, we never assume that what has worked in Zimbabwe will work exactly the same in a different part of the world. Just 2 weeks ago, I came back from El Salvador, where we are introducing Friendship Bench. And the context of El Salvador, the historical context, is very important. El Salvador is a country that has seen generations of trauma and violence, the history of the gang violence, the history of crime has left the population quite traumatized. And so introducing Friendship Bench in that environment really required going deep into the communities to interact with the community gatekeepers with regards to how they thought a model like Friendship Bench could be adopted or replicated in that environment. So what we do, and this is what we also did in El Salvador, is once we've agreed, yes, there's a need for Friendship Bench to go to El Salvador, we normally start off with what we call a theory of change workshop wherever we go. The theory of change workshop really helps us to build consensus around how best to introduce Friendship Bench in a new place. What are the potential barriers? What are the potential limitations? How do we address them? What assumptions are we making as we bring Friendship Bench to a new place? So, for instance, in El Salvador, we zeroed in on a delivering agent for the Friendship Bench, which is very unusual because that's what the community wanted. So in El Salvador, Friendship Bench is being delivered by Catholic nuns, sisters who are working for the Roman Catholic churches in El Salvador, because the community felt they were respected,
right,
and they could be trusted, and they were rooted in the community. So we have never worked with nuns before, but because that's what the community wanted, that's what we are doing. When we went to New York City, we worked with the LGBTQ plus community because that was what the community felt was important when we were in Harlem doing Friendship Bench. So I think the delivery of Friendship Bench depends a lot on how the theory of change informs the different steps.
And those are such amazing examples on El Salvador and having the nuns implemented. And I think one of the most successful ones, I mean, this comes from our research of work that you're doing beyond Zimbabwe, was in Zanzibar. And I wonder if you want to talk also a little bit about that, because it's interesting how the Friendship Bench takes different forms in different countries. So could you talk a little bit about what you were able to do in Zanzibar?
Yeah, Zanzibar is probably one of our success stories because it's still running. It's almost 10 years now. Yeah, that's true. So in Zanzibar, again, we went through the theory of change. But again, like in El Salvador, Zanzibar has a strong Muslim influence, and Muslim or Islam plays a critical role in the lives of people in Zanzibar. And it was felt that there was a need to bring on board the imams, the leaders within the mosques who play a pivotal role in community development. So some of the people we trained were from that environment. But the other thing that also fascinated me about Zanzibar was the fact that they felt that women also needed to be trained. It's a very patriarchal society. And so that was a good mix. And we had these women. And then the other thing about Zanzibar, which I think has contributed to it moving forward and sustaining the model, is the fact that the government was involved. And they had a strong NGO that was working very closely with the government. Ultimately, at Friendship Bench, we believe that the best doer at scale of Friendship Bench is government, because governments can do things on a very large scale. And it's for that very reason that in Zimbabwe, we are also focusing on working with the government as we scale in all the 10 provinces.
And Dixon, just out of curiosity, when it comes to public spaces, you've talked about the government, so I'm also assuming some of the spaces that you've ended up working with might be public-private properties, but is access to public spaces like parks something that you have considered when planning the launch of a new Friendship Bench or when you've gone into a new country?
Certainly, we have thought about that. And the USA is probably one of the places outside of Zimbabwe where there's a strong interest in Friendship Bench. And we actually have moved towards establishing a small team of people who actually will eventually manage Friendship Bench USA. And they are organizations working in communities that are keen to have friendship benches in the parks. Certainly, Help Age, who we are working with in Washington, D.C., in Anacostia, do have some of their benches in a sort of outside park-like setting. But we would love to have friendship benches installed in public spaces like parks.
Right.
But we respond to what the community deems to be the best place for friendship benches. When we went to Kericho in Kenya, for instance, we thought the friendship benches would be somewhere close to the health facilities where the tea pickers from Kericho, Tea Estate, would then visit the health facility. But no, they said, no, we want the friendship benches in the Tea Estate. A different approach to doing things. And so that's where the friendship benches ended up, in the Tea Estate. So one never quite knows where the friendship benches will end up being placed. But it's ultimately about creating that space to make people feel comfortable to share their stories. And if people feel more comfortable sharing their stories within the confines of a tea plantation, that is fine. If they want it to be in the pavement of Harlem or the Bronx, that is also quite okay. But it's very unpredictable. You can never tell where it's going to be.
And one of the things, just to connect the dots on Connecting the Dots podcast, one of the things is you said during COVID, the upsurge that you saw with mental health was as a result of COVID and the loneliness that came out of that and people not being connected. I wonder if for you, you started with one thing, a friendship bench, and you've rolled it out globally to different countries and experiencing different things in how you end up setting and implementing this critical and simple intervention for mental health. And I wonder, in a world that is significantly aging, and this is beyond the continent, have you seen that actually this is something that works even better for countries where people are beginning to age faster? And the reason why I say not the continent is because we have a relatively younger population, but I can imagine when you're using grandmothers or grandfathers, maybe in places like Europe or even places like Japan, and I don't know if you've gone further into Japan or Southeast Asia, I wonder if this is also being embraced because it's now using people who are beginning to transition from jobs into retirement and now finding opportunities to be able to support and contribute to the community health.
Yeah, absolutely, Juliet. With my work around the longevity program. So I'm an Ashoka fellow, and Ashoka has this big program around longevity where we seek to tap into the wisdom of our elders in our communities across the world. And so there's a real interest and fascination around the role that the aging population can play in what we're calling intergenerational connectedness.
Mhm.
And so there's definitely a real need. We are most likely going to be going to Italy through Ashoka to start one of our big engagements with the elderly in populations in Italy. So that will be something that we will probably look at as our first big initiative, but teaming up with Ashoka. It's still very early days, but if it does go through and it happens, it's most likely going to happen sometime next year. But yes, people are living longer. And by the year 2030, I think it's estimated that about 20%, if not more, in fact, not 20%, but we will have over 1 billion people aged 70 and above.
Wow.
And so we need to leverage and utilize their expertise to increase intergenerational connectedness and help the young people as well.
And Dixon, bringing the discussion back onto the continent, what are the top 3 things that you'd say are some of the ways we need to modify mental health practice in Africa to better meet the needs of our people?
I think we need to lean into our own frameworks. We need to lean into our own culture and our own values as Africans. We often adopt frameworks which are developed elsewhere and assume that those frameworks will serve our people. But, with mental health, because there's such a strong cultural, spiritual emphasis to one's mental health, it's really critical for us to embrace the culture as well. I think that is probably one of the reasons that Friendship Bench has been attractive to a lot of people. It's because we lean into the culture. We use the cultural idioms of distress to navigate through the different symptoms that people bring to the bench. We don't focus on your diagnosis as is traditionally done in Western models of care. At Friendship Bench, we focus into your story. Africa has a strong oral history. And so, in a way, in some parts of Africa, they have, I think it's mainly West Africa, they have these storytellers who tell poems at village level, and they move from village to village. They are called griots. And to a large extent, the grandmothers at Friendship Bench are almost like these griots, because they are sharing their stories as well. But within sharing that story, they are also finding a way to connect, finding a way to build resilience in the people that bring the different challenges that they're facing at the Friendship Bench. So we need to lean into these aspects of our culture, which have always been there.
I'm taking away, the use of local expertise in our local context, the use of griots, and then also leaning into our culture as some of the ways in which we can improve or modify our mental health practice on the continent. And Dixon, as we begin to wrap up the podcast, we always are excited to get to hear from you. Who are African scientists that inspire you? And as I say this, I should also let you know that in earlier episodes, we've had guests who have called upon you as an example of scientists who inspire other scientists. So just to put it up there for you that there are other scientists who are very fascinated and excited by the work that you're doing. So who are those people to you?
One of the scientists, obviously, in my space who has always inspired me is, I think he's now retired, is Oye Goreje from Nigeria. Oye was one of the first African scientists to really lean into traditional medicine as a tool for helping people struggling with mental health issues. When you look at traditional medicine in Africa, it is often shunned.
Right.
It is often assumed to be something which is not evidence-based. But Oye has managed to unpack a lot of the things around traditional medicine, which have really inspired a lot of people, certainly has inspired me to think differently. So there's Oye Goreje, and there are a lot of other people, too many to mention. But I just thought I'd touch on that one individual who has been a role model for a long time.
And, just on your point about traditional medicine getting a bad rep, I think maybe we need to rethink or rebrand the way we call it, because Chinese medicine is traditional medicine, but we don't walk around saying Chinese traditional medicine. Maybe we need to give it proper branding.
That is true. And the only way we are going to do that is by telling our own stories. I always say to my team at Friendship Bench, we have to tell our own stories. We have to take ownership of this journey. We have to take ownership of our stories, because when you look at history, the history of Africa is predominantly written by people who are not Africans.
Right.
And history, the way it's perceived, will always be determined by who writes the stories. That's where it starts from.
That's a really good point to begin to wrap up on. And on this podcast, we always ask our guests about what excites or inspires you. And then when you look around the world, what's the one thing that scares you, would you say?
So what inspires me and what gets me excited around Friendship Bench is the Friendship Bench in a box. This is our scale strategy. I believe that the Friendship Bench in a box is strengthened in the right way. It could really be a game changer globally. It could make it possible for anyone, anywhere in the world to do Friendship Bench. So that really excites me, particularly the next phase of my journey, which is going to focus primarily on strengthening the Friendship Bench. That really excites me. What gets me worried about the world today is the level of disconnection. We are extremely disconnected from each other, and we need to do a lot more to bring back those simple community values that brought people together in very simple ways. We need to go back to the community. We need to lean into communities and use communities to reconnect people.
Dixon, if you were a magician and you had a magic wand, what are the three things you'd change with the world today?
I would make empathy a lot more readily available so that people embraced empathy as a tool for communication. At Friendship Bench, we say empathy is the ability to make people feel respected and understood. That's the one thing I would want to see. I would want to see people using less digital devices and leaning into human face-to-face interaction, just sitting on a bench and talking to someone.
Right.
Thirdly, I would like to see a lot more intergenerational connectedness. There's so much we can learn from our elders. I've learned so much from the grandmothers over the last 10 years plus. It's so powerful. I'm blessed.
Amazing. As somebody who grew up very attached to their grandmother, I echo your sentiments, because I think if it was not for my grandmother being a strong part of my life growing up, I'm not quite sure if I'd have the level of sensitivity that I have today. Your parting shots, your call to action?
Every one of us can make a difference in our communities. If there's a single take-home message that we can all embrace, it's empathy. The ability to make people feel respected and understood. Lean into the empathy and your world will become better.
Dixon, thank you so much for your time, for joining us on this episode of Connecting the Dots podcast. We're very excited to shine a light on the work that you're doing, not only in Zimbabwe, but across the continent and also across the world. We are hoping that you'll be sending us here at Connecting the Dots podcast, the Friendship Bench in a box, because also for us, we'd like to be able to talk a lot about it and give you the visibility that you deserve. So thank you, and wishing you all the best in all the work that you do, and just appreciating you for the time.
Thank you very much. Thank you for having me. Take care.
Thanks for tuning in to Connecting the Dots podcast, created by me, Juliet. This episode was brought to life by Mumbua and Kevin at Silent Global in Nairobi, Kenya. If you enjoyed this episode, don't just keep it to yourself. Share it. Tag us on CTD Pod Africa on all platforms. Keep the conversation going. Let us know what you'd love to hear about, and join me on the next episode as I interview the next amazing scientist here on Connecting the Dots podcast.